Hi, my name is Catherine Day, and I am a clinical technician in the Medical Intensive Care Unit at the Medical Center of Central Georgia. Every day, I see patients who are critically ill due to the primary cause of smoking. Unlike a lot of people, I see the real-life effects smoking can have on the body. While research in smoking has come a long way in the last 50 years, there is still a lot to be done to make sure everyone is informed of the diseases caused by smoking. Did you know, according to the Center for Disease Control, that smoking is the leading preventable cause of death in the United States? And since the first Surgeon General's report on smoking and health in 1964, more than 20 million people have died from smoking. This news is staggering to me. Hearing that smoking is bad for your health is not enough to inform our communities about the risk of smoking. However, by informing our audience on the three main diseases associated with smoking, we can all have a clearer understanding of how smoking affects the body. The three main diseases associated with smoking that I will be discussing are cancer, chronic obstructive pulmonary disease, and peripheral arterial disease. Smokers are at an increased risk for developing cancer than non-smokers. Cancer manifests from the mutation of the DNA in the cells. The mutation is caused from the hundreds of carcinogens that are found in cigarettes. The DNA in the cells becomes damaged and causes the cells to grow abnormally fast. According to surgeongeneral.gov, lung cancer is the #1 cancer killer in men and women. Almost all lung cancer is caused by smoking, whether it's secondhand smoke or primary ingestion. The Surgeon General also states that nearly 9 out of 10 lung cancers are caused by smoking. The second disease that I will talk about is chronic obstructive pulmonary disease, or COPD. COPD is a disease of the respiratory system that is caused by damage to the lining of your airway and lungs. This damage is caused by the cigarette smoke, which kills and paralyzes the cilia lining your lungs and airway. When the cilia die, it is very hard for the individual to expel CO2 and expand their lungs. Opposite of what you may think, the more oxygen you give a person with COPD, the worse their condition can become. This is because they cannot get rid of the waste product of oxygen, which is carbon dioxide or CO2. Many people will have a chest shaped like a barrel because they must work very hard to breathe. Unfortunately, there is no cure for COPD. Lastly, the third disease is peripheral arterial disease. In smokers, is caused by the narrowing of vessels throughout the body. According to the Surgeon General, inflammation from smoking causes the vessels to swell. This narrowing allows plaque buildup in the arteries, which limits the amount of blood flow. When blood flow is limited or stopped, that part of the body begins to suffer. Sometimes, an amputation of the limb is necessary if blood flow has become obstructed enough. Many people will present with leg pain and leg swelling before they find out they have peripheral arterial disease. While these are not all the diseases caused by smoking, they are very common and need to be talked about more. As we come to a close, we see that we have a direct impact on the health of our bodies. What we put into our body will have either a positive or negative impact. Hopefully, by speaking about the three main diseases of smoking, we can all be more informed in making our decisions. Thank you.